Hello and welcome back to another Pearl, and this is the episode where we answer the question of the case that was presented a few days ago. If you did see the case was a male child of 6 years old who presented with abdominal swelling and abdominal pain for 6 weeks, and he comes into your clinic and he is from Ethiopia. So the question was, how do you manage this case? And in order to manage the case, you have to first know what the diagnosis is. So given that the patient comes from North Africa, Ethiopia, from a background where there's a lot of farming and looking after livestock, most diagnosis given the symptoms and where the patient is coming from is Echinococus granulosus. So that is the diagnosis. So let's see what Echinococus granulosus is and how do we treat a patient with Echinococus granulosus. Where does it come from? What does it look like in someone who has the disease? It's a parasitic disease and it is of the tapeworm family. The disease is found worldwide, but most commonly in the rural areas of the Mediterranean region. So this is like North Africa, Semitic countries. You have Middle East and South America, as well as other parts of Africa, mostly the northern and southern parts of Africa. So the life cycle of the Echinococus granulosus involves a definitive host or intermediate host. So we're talking like domestic animals like dogs, cattle, sheep, livestock. So what happens is these animals, they transmit the disease to other human beings. The excrete goes into whether food source or contaminated water, and then we consume the food, and we also consume the animal. And once we consume things that are contaminated, then it goes into the human body, goes into the small intestine first, and that's where the eggs hatch. Released larva, which migrates to different parts of the body, is in the liver and in the lungs. It seeds in those tissues. They form cysts, big cysts. It's mechanical disruption of the tissue surrounding the organ, and it can also cause a lot of other problems that manifest as symptoms later on when the patient presents. So if you can remember, the patient presented with abdominal swelling, abdominal pain, and just loss of appetite and easy fatigability. So we found out that the patient had cysts both in the lungs and in the liver, and the question was, how do we treat these patients? We investigate and make sure that we know what we're treating. So yes, we have a mess, but what is the cause of the mess? What has caused the mess in the first place? So how do we diagnose Echinococus granulosus? The first thing we'd like to do is to find out the presence of the disease, to rule out the diagnosis. We do serology tests, immunology tests. These are tests like number one, ELISA. ELISA is enzyme-linked immunosorbent assay, which you can also do heme agglutination tests, a PCR, polymerase chain reaction test, which is not a test that's typically used, but still, yes, it can be used to detect the presence of organism or the parasite. CT scan, you can do an ultrasound scan to find out the presence of the cyst, and that would assist you with whether this cyst is operable, whether this cyst is a new cyst, whether it's an old cyst, whether it can be treated with medication or it needs to be removed. So we give as a treatment, well, we give simple medication is albendazole or mebendazole preoperatively and then postoperatively after the cyst is removed from whichever site the cyst is removed from. And this will kill off other larvae, other eggs, and also kill off any presence of the organism within the body. We'd have to come for follow-up checks and also to make sure there are no further surgical complications. That is fast rundown of Echinococus granulosus and the problems it can cause, or pathophysiology of Echinococus granulosus. Watch out, and if you have someone who has developed cyst, always have in the back of your mind, Echinococus granulosus, the parasite that can cause cysts. We out.